So for the interview assignment, I interviewed Jennifer Livingston, who is a psychiatric nurse practitioner. Prior to working in her current job, she worked in a hospital setting as a bedside nurse doing labor and delivery care. She also did special nurse care and was the manager at the birthing center at St. John's Hospital. Jennifer said that her experience giving care to antepartum, intrapartum, and postpartum parents and taking care of the babies from before birth to delivery and past delivery gave her the passion to further her education and find ways to help postpartum families. Her first degree was a degree in biology from the University of Colorado, Denver, and then her second degree was a BSN in nursing from Regis University, and her final degree was a psychiatric mental health practitioner degree from Walden University. Jennifer is now a board-certified psychiatric mental health practitioner working at Rocky Mountain Mental Health, which is a private practice that focuses on providing mental care to mothers prior, during, and after pregnancy. Her services include pregnancy planning and medication management while breastfeeding, pregnancy and postpartum depression, OCD and anxiety, infertility counseling, marriage counseling, premenstrual dysphoric disorder, and menopause-related mood changes. In the state of Colorado, psychiatric mental health nurse practitioners are able to prescribe medications within their scope. So Jennifer prescribes a lot of antidepressants for postpartum mothers who are experiencing postpartum depression or anxiety, and she's able to do this care along with her cognitive behavioral therapy rather than sending her clients to a separate psychiatrist for secondary medication, which is really nice that she's able to provide holistic care in one place instead of having to send them to separate places where appointments can take weeks or months. Jennifer told me that one of the most fulfilling parts of her job comes from being able to actually help the mothers that she once had to send away from the hospital. She spoke a lot about how there was a lot of mothers after birth who were definitely suffering from mental health disorders, and that was something she was able to recognize even just being a bedside nurse or being a labor and delivery nurse, that the mothers coming in to give birth or after giving birth were definitely experiencing some sort of depression or anxiety, and her job was to get the baby healthy, and then once the baby was healthy, the mothers would leave with the baby, and she always wondered what happened to the baby when they went home, because these mothers were experiencing mental health difficulties of their own and then were sent home to take care of a newborn baby. So she explained that now that she gets to care for the woman in this position, she experiences a lot of fulfillment from that, and she also has such extensive knowledge of the process of giving birth and the process of pregnancy since she worked as a nurse in labor and delivery care. So she really is able to sympathize with the mothers and is able to understand not only what they went through when they were pregnant, but also what the birthing process was like, and after, how to care for the baby in the best way. So she's really able to build some rapport with her clients and make them feel comfortable with her, knowing that she understands the physical and mental aspects that went into getting them to where they are now. Jennifer said one of the most difficult parts of working with postpartum mothers is breaking down the stigmas that these mothers are failing at motherhood if they need mental health services themselves. Many mothers feel that they're inadequate because they have to go in and get care for themselves when they have a baby at home that needs care. So breaking down that stigma and helping these mothers see that they're not failing and that they need to take care of themselves as well is a really difficult process, and can also be difficult to create a space of non-judgment and trust within therapy, which is really important, especially for cognitive behavioral therapy, for the therapist to have some sort of trusting therapeutic relationship with the client. And that can be difficult because while she's providing guidance and support for the mother, she also needs to be making sure the baby is in a safe and healthy environment, and she is a mandated reporter if there's any instance of child abuse or neglect. So she has to look for those signs, but she also needs to create this environment where the mother can tell her different things. And I think it can also be difficult for her because she's in a different place of having her own opinions on things as well, because she is also a mother, and so maybe something that worked for her she would love to recommend, but as a therapist, your job isn't necessarily to give advice or tell your client how to do something, but especially in cognitive behavioral therapy, it's more to identify problems and find solutions together. Jennifer continues to maintain her psychiatric mental health nurse practitioner license, and she also continues with her RN license as well. So at any time, she could always go back to bedside care as a a labor and delivery nurse or any other kind of nurse. And in the state of Colorado, it's not required to do continued education in order to renew your license. There are steps you have to take, just fees and submitting the paperwork, but there's no continued education required. So Jennifer pursues the extra learning as a hobby on the side. She explains that she reads books and articles and studies and listens to podcasts, and she's also still able to talk to other psychiatric mental health nurse practitioners. She works in a clinic or in a private practice of 3 other girls who are also psychiatric mental health nurse practitioners, so they're all able to collaborate and speak about the different things that they've learned and different techniques that have been effective for them in treatment. And she also still has friends back at the hospital that she says she gets to talk to, and that it's helpful to hear new information about new birthing technologies and kind of what nurses are hearing that mothers are experiencing now, which has been helpful for her so that she can kind of stay up to date on the challenges that are presently facing mothers giving birth, not only in the hospital but also like after, and also the stress going in to giving birth. Jennifer mentioned that Jennifer recommended that a student who wanted to pursue the same career as her as a psychiatric mental health practitioner working with postpartum mothers in a private practice setting where she also provides cognitive behavioral therapy services in addition to prescribing medication. She recommended that a student looking at that would actually serve as a bedside nurse prior to becoming a psychiatric nurse practitioner. She said that her experience as a bedside nurse was super important for her to be able to learn what happens for mothers and babies and the physical and the mental aspect of the whole process. And it also gives her a lot of credibility with her clients because she has seen a lot and knows a lot. And so she said that the knowledge that she gained in combination with her studies on psychiatric aspects of having a baby really allow her to provide the best care to the mother and build the rapport with her clients just because of all of her experience and knowledge. I think the main thing that I learned through doing this interview was how important it is to know about the biological and physical aspects of a disease as well as the mental aspects. It was really clear that having that extra knowledge on, well, the 2 degrees to begin with on biology and also nursing, that gave her a lot of on paper knowledge as well as the experience of being a nurse and caring for the physical aspects of someone really helped Jennifer to then provide psychiatric care to someone. So I think that was the biggest takeaway I had, is that there's so much out there to learn, and having more knowledge is really what's going to help your client the most. And I think that applies to a lot of things as well besides just biological knowledge. I mean, it's the same thing with having multicultural counseling knowledge and being able to adjust to what your client needs based on the culture that they may come from. So I think the biggest thing that I took away was that having that experience is one of the most important parts of being a counselor, and as much as studying helps, I think that actually getting on the ground and working with the population that you want to work with in the future is really important for your knowledge and to build credibility with the people that you're working with, especially because I think if you're going into a counseling session and you haven't spent a lot of time around the population that you're counseling, you're going to have a big knowledge gap and you're not going to be able to build the therapeutic relationship with your client. And I think that Jennifer's really able to do that because she has such extensive experience with them. I don't want to be the exact same. I don't want to be working with the exact same population that she is. I want to work in substance abuse. So I think that for me, one thing I've really learned from this assignment is that I should focus on getting in environments where I'd be around that population of people, even if it's not in a counseling way right now. It could be in a volunteering way, like at a harm reduction action center, or joining more of the online AA meetings or the in-person ones if I'm able to, and just learning more about that population.